Hi everyone, this is Dr. Stefan. In this video, I'd like to answer a comment about asthma, Symbicort, and palpitations. The question goes more or less like this. Now, I'm 21 years old. 3 or 4 days ago, I found out that I've got asthma, I have a Symbicort inhaler. Is it normal to have palpitations because of it? For example, I was lying in bed, I was lying flat, and I felt some sort of a shivering in my heart, some sort of a palpitation, very strange. It's true that I felt it before because of anxiety, but now it happened just after I've used the inhaler. Is this normal? Should I be worried? Should I stop the treatment with this inhaler, with the Symbicort inhaler? Now, this is a fantastic question, and I do thank people who ask me these questions because they really are things we face in clinical practice many times. Now, first of all, I'd like to just say I'm not your doctor. I am some person on the internet. I'm the doctor on the internet. So please, if you're having any health problems, do consider seeing your doctor as soon as possible if you are worried about your health, because they are the only person who can give you personalized advice in your case. What I'm saying here may not apply to your case. Now, that being said, I think there are a couple of things to discuss here. Now, first of all, let's talk about the anxiety, because many patients who have asthma do suffer with anxiety as well. And it's absolutely normal if you think about it. If you're having a breathing problem, if you're young, like this person is 21 years old. So, of course, when you're young, you're full of life, you're healthy. You don't want to have a condition where you need to take all kinds of inhalers. That will cause a lot of anxiety, and especially if you're young and fit and you're, for example, going for a run with your friends and you suddenly can't breathe. It's really anxiety inducing. So sometimes the anxiety can be caused by other things, in life, but it can also be related to actually having this diagnosis of asthma. I think that's really important to acknowledge from the get-go. And indeed, sometimes anxiety can be associated with palpitations, with your heart going a little bit crazy, because in those circumstances, when you're really anxious, you tend to panic, and when you have a panic attack, you tend to hyperventilate. Your heart goes crazy, your heart rate goes up. Everything is very hard to control in those moments. So it's really important to discuss with your doctor to try to tease out the difference, to determine what's different. Are you really suffering more with anxiety or more with asthma? Because it's really important going forward to know that. If you know that, you will be in a much better position to control your condition better, because you'll recognize what you are experiencing in those moments. Are you experiencing a panic attack, or are you experiencing an asthma attack? Because if you are having an asthma attack, you probably need to take some inhaler to control it. If you are having an anxiety attack, well, that means that you need to deal with it in a different way. So that's really important to try to differentiate with your doctor to see whether it's the anxiety or the asthma triggering those palpitations, those symptoms. Now, obviously, palpitations can be an indication that there may be a heart condition at play as well. So this is again something that I would discuss with your doctor. So if you're having a lot of palpitations, if your heart is really doing funny things, at least having a discussion with your doctor, potentially who may request some sort of a heart trace, an electrocardiogram, an ECG, just to measure if there's anything that shows up there, any sort of abnormal beats, any abnormal heart rhythms, things like that. That can be important to rule out. And actually, if you do end up ruling that out, you may actually be in a position where you'll be less anxious, because you'll know that it's probably something not to worry about. And your doctor can request a lot of tests in that scenario. They can, give you sort of a device that you wear at home. It's like a holter, heart trace device that you basically wear for maybe 24 hours, and it records if you're having these palpitations and what they look like, if they are related to any abnormal heart rhythms. So these are important things to discuss with your doctor. I really think that's really important. Now, coming back to the Symbicort inhaler, and not only Symbicort inhaler, but most inhalers that are used, it is theoretically possible that they may induce some heart racing, palpitations, things like that. It is possible that can happen when you take a lot from an inhaler, especially if you administer a lot of doses. Usually, the doses in inhalers are very low. So whatever you are inhaling from those little devices, the amount of medication that you're actually breathing in is very low. Most of it isn't even absorbed in the rest of your body. It just stays at the level of the airways. So I wouldn't worry too much, because in most cases, inhalers are extremely safe medications. And they are also important to control the asthma. So here, there comes a risk-benefit of inhalers versus, the treatment versus the disease, which is the most important to control. And if your asthma is really bad, you probably need some form of treatment. Now, obviously, if that treatment is causing palpitations repeatedly every time you're taking it, it's probably a good idea to discuss with your doctor to see whether it's actually the inhaler causing that. Because sometimes your doctor may suggest, for example, going on a different inhaler and seeing if you're getting the same issues. Maybe they will try to analyze whether it's something related to your anxiety that's causing that. So these are really important conversations to have at the beginning, especially like this person who was asking me this question. They've had a diagnosis of asthma for 3 or 4 days. So obviously they don't understand the condition very well at this stage. Asthma is a condition that can last for years or all your life. So it's important at the beginning to get as much information as you can from your doctor about your condition, to try to understand your body, to feel what's going on, and to determine whether it's something related to your asthma, to your anxiety, to your medication. It's really important to determine what is going on and what's the trigger for what you're experiencing. But it's important to try to do that in a very pragmatic way. And this is something that I can tell you probably in a video. It may be harder for your doctor to actually tell you to try to be quite pragmatic with yourself. So you need to really, really think what is going on in your case. And it can be sometimes really, really hard to accept that it is the anxiety that's causing the problem, especially to admit it to another person. So that's something that you may have to work around and actually be honest with your doctor about the level of your anxiety. So basically what I'm trying to say is to try to be very, very honest with yourself. What do you think is going on? But if you are worried, do talk to your doctor, because there are tests that can be done to try to determine whether it is the inhaler that's causing that, or whether it is the anxiety, or whether it is just something related to your heart potentially that has nothing to do with the asthma, or whether it's something completely different. It's just a sensation, because many young individuals can actually have palpitations. They can have these extra beats that they feel, and actually it's absolutely normal. It's something that goes away over time. But knowing for certain by looking online is not possible. So that's why I do urge you to try to visit your doctor as often as you can, especially at the beginning when you are just learning about how to manage your asthma correctly, because then you will have all the information going forward, and at least that will limit a little bit the anxiety you might have related to the condition. And it also might limit your anxieties related to the treatments, because most of these treatments are actually quite safe. If you are having potential side effects from a treatment that's been prescribed to you for a new condition, it's really important to go back to your doctor and talk about it as soon as possible before you have further issues, because it may be the treatment, it may be the anxiety in this case, it may be something else that hasn't been diagnosed before, or you haven't discussed with your doctor before, some other condition, or it may be nothing at all. But it's something that you will only know if you actually take the first step and go talk to your doctor. So that's what I'm going to try on this channel in most of my videos to do, is try to encourage you to go see your doctor whenever possible. And I hope this information is at least helpful to guide you in that direction. Thank you for watching, and I'll see you in future videos.